Dr. Jha, thank you so much.
Good morning. Thanks for having me
here. We're always interested in, the coronavirus response coordinator is not exactly a position that lots of rosaries and triumphs are shared. So you came to do this in the administration. Are you having a good time?
Am I having a good time? It's intense. It's a huge privilege. I feel like we're having real impact.
Where are you having impact?
Well, I think we're making big impacts on availability of treatments. So I'll give you an example. I came into this job just over 3 months ago. At that point, Paxlovid, which I think is just a fantastic, the data on this is very clear. We were prescribing as a country about 4,000 or 5,000 prescriptions a day.
Wow.
We're now at about 35,000 a day in 3 months. I think we have made Paxlovid widely available, easily accessible. These are the things that you can do. When we decide we got to make treatments easier for people to get, we just have a bunch of levers we can pull to drive that. And I think,
So are we at a wall? We had Anthony Fauci up here. So 67% of the American public's been vaccinated. About half those have been boosted, which overall is not a great picture, according to him. I interviewed former Mayor Eric Garcetti of Los Angeles, or maybe he's still mayor. Eric Garcetti, whoever he may be now.
Soon to be ambassador.
But he said something really cool when there was vaccine shortages and people like myself were figuring out how to get in one of the categories to get this as we were kind of all dealing with it. He said that there were, throughout the city of Los Angeles, they had vaccine party nights. So that people sent their surplus that wasn't used that day to these places at midnight. They had music, they had drinks and, probably lemonade or whatever, and they were able to use it. I thought it was one of the most innovative ways to help broaden this. I didn't see a lot of pickup of that model around the country. Are there things that we're not doing as we sit in Washington and say, okay, we've got to find seductive or interesting or dynamic ways to encourage people to get vaccinated? Are we doing those things?
Yeah, it's a great question. So I think the strategies you use to not waste doses in the early days when demand way outstrips supply is different than where we are now, right? Where there's plenty of supply.
Yeah.
And it's interesting, it's easy to say the demand isn't there. I don't even think that's quite right. I think certainly that kind of demand that we saw in January, February, March of 2021 is not there, but there's still plenty of people who say they're willing to get vaccinated. The ground game now is about making it easier for people, making it accessible. So mobile vans that deliver vaccines, not quite as sexy as parties with drinks, but probably more effective for where we are in terms of people who are not getting it. We're seeing cities do that. We're working with cities and states to try to make that available. And by the way, that model doesn't just work for vaccines, it also works for treatments. So we have been, New York City, for instance, just launched this, what I think is a fabulous program. It's a mobile test and treat site. You take a mobile van, it's got tests, it's got treatments, you send them into communities where there isn't big uptake of either testing or treatments, and you make it super easy for people. You really literally go meet people where they are. I think those kinds of things are happening. And of course, our job in government is to support that, to enable that, to get the word out about those things, help more cities and states do those kinds of things.
A big, ferocious river that has run through this morning's conversations is that America's health outcomes are inequitable, that we do not have equity built in. There's a lot of reasons: systemic racism, divisions, tradition, et cetera. And as I get to some of the realities of COVID and who it impacted, part of it you can look at as sort of, the bias of the healthcare system. Part of it is an absence of trust between certain communities in that healthcare system. Both the Trump and Biden administration spent a lot of money on trusted ambassadors, folks coming in that they would be there. What is the status of that? Did that work? Did it fail? Is it still going on?
The status of the equity enterprise?
The equity challenge, but also having people see folks they trust that go into communities. With all due respect to Dr. Fauci, whom I happen to trust, not everybody trusts Dr. Fauci. So, how do you deal with that?
Yeah, even Dr. Fauci, no one is trusted by everybody, right? And so we need different voices for different people in different communities. Look, when the president came in 18 months ago, it was already clear that this pandemic was having a very disparate impact on different communities, right? I often say we're all in this together, but we're not all in this together the same, right? And we're not all in this together equally. So we see these very disparate impacts. And the president made a commitment, and I'm going to actually get to, did it actually work, to your question. major focus on a health equity task force, major focus on community health centers. Remember those mass vaccination sites that we were set up?
Arenas.
Arenas,
Yeah.
there was a criteria in there. It had to be in a community that was socially vulnerable. Like that was a feature of the response. And what that meant was that in January, February, March of 2020, you saw initially this gap in vaccinations between white Americans and African Americans and Latinos. And by April, May, that gap had closed. On boosters, which again, not enough people are boosted, but initially as boosters rolled out, a little gap opened up. That gap has closed, and right now booster rates are the same for different ethnic and racial groups. Vaccination rates are the same. That stuff doesn't happen accidentally, right? It's deliberate. And so if the question is that an effort that's still ongoing? Absolutely. Is it making a difference? I can tell you all the stuff we're doing, but at the end of the day, you got to judge us by outcomes. And the outcomes are we're getting equitable levels of vaccinations, boosting. Last but not least, I just told you we've had this massive rollout of therapeutics. So what do we do? As those are going up, the question I ask the team, are we doing this equitably? Great that lots more Americans are getting treated. Are all Americans getting access to treatments in the same way? The answer, not as equitable as we need it to. We're starting to see a gap open up in communities that are more socially vulnerable with lower rates of Paxlovid. So unacceptable. So now we are going back, looking at the data, trying to figure out what else do we need to be doing. We just opened up pharmacists being able to prescribe. We think that's an important equity play in giving more people access. We're doing a whole series of other things. And my point is, don't judge us just by those actions. Judge us by, like, bring me back in 3 months and make me show you that we actually close those gaps. That's what matters.
You know, one of the things that happened is Operation Warp Speed helped produce, in a remarkable short period of time, you know, based on historical models, vaccine alternatives to approach this. And then that box got checked off. Should we have called it Operation Marathon instead and have kept it going? Do we have, you know, Tony Fauci this morning said, we need new vaccines.
Yep.
And so did we make a mistake of thinking, we're done, we solved it, we got the vaccines, it's now just a burden of people getting them, as opposed to continuing the science and development?
It's a great question. So first of all, Tony's of course right. We do need a new generation of vaccines. I think Operation Warp Speed was immensely successful.
But then we checked off the box.
Yeah, but we accomplished what we thought we needed at the time. Remember, the theory of the case in 2020 was we build these vaccines, everybody gets vaccinated, everything's better. The pandemic is over. It turned out that the science turned out to be a bit more complicated. The virus turned out to be a bit more complicated. What we need now is not quite an Operation Warp Speed in the same way, but we definitely need a rapid acceleration of development of the next generation vaccines. And we're talking about pan-coronavirus vaccines that are going to be resistant to new variants. We're talking about mucosal vaccines that will actually prevent infection and transmission. We haven't really built very many mucosal vaccines. We've got one, flu mist, it had issues. So my point is,
So what's a mucosal vaccine cost?
Well, there's only, so we don't have
10
one.
billion, 20 billion, 2 billion?
So if you're talking about investments that we need to make, and this is where we're going to need help from our friends in Congress, right? So the administration, we have been working, certainly in the time that I have been there, incredibly hard at looking at the next generation of vaccines, saying what can we do from an NIH point of view, from a BARDA point of view, from an FDA point of view. But we absolutely are going to need a new set of investments. These things will come on eventually over the next 3 to 5 years. If we want to accelerate that and make vaccines that are truly variant resistant or mucosal vaccines widely available, they are going to require, and I don't have an exact number, but probably in the...
But you've asked Congress to give you money that they haven't given you yet, right?
We have asked Congress for, and at this point, I mean, we've mostly asked for COVID response money. We clearly need resources for building this next generation of vaccines. Now, markets work, and they will eventually, as I said, in 5 years, produce these things. If we want them in much shorter time period, we're going to need the kind of investments that Congress needs to help us with to accelerate that. I think the science on this is moving very quickly. We need to have the government play exactly the kind of classic role it plays of de-risking, accelerating the science, making the manufacturing go faster, all the things that can get us to a better place.
Let me ask you a question. There was a, there were Chinese efforts in developing vaccines, Russian efforts, of course, European efforts, and I'm just wondering, and I'm not trying to get a rah-rah answer by any means, but I'm just interested in the state, the ecosystem of science in this health development sector of the United States. Are there aspects of it we should be worried about or concerned as we look, because in a way, developing a COVID vaccine is a national security issue.
Absolutely.
And it is not trivial. And the resources needed are huge. And there are potential strategic gains that other countries might make if they outperform the United States.
Yeah.
How secure is our science ecosystem today?
That's a great question. And I actually think the way you framed it is really, really important. Let me make kind of 2 points on this. One is people often say, how did we build these vaccines so fast? It wasn't that fast. Actually, we'd had 15 years of investments that got us primed to build vaccines. Again, not taking away from Operation Warp Speed, which was terrific and was very helpful and successful, but a lot of science had gone into it. We have got to continue doing those kinds of investments. When we were talking about mucosal vaccines, let's talk about that as a national security issue. Obviously, we're talking about that for COVID. But once we figure out how to really build high-quality mucosal vaccines and then build a platform for manufacturing, the next respiratory virus, which may be natural, maybe a biological threat from a rogue nation, when it arrives, if we have made the investments in building these things, it's going to allow us to build mucosal vaccines way, way faster against that next pathogen. Those are the kinds of investments we've made in the past. I hope that we continue making those kinds of investments because we don't know when they will pay off, but when they pay off big, as these mRNA vaccines did.
Now, I haven't followed it all that closely, so I might botch this question. But one of the things I'm interested in is what do we do next round? We'll be smart. Former Senator Bill Frist was part of a simulation playbook exercise. We had Rick Bright and other people in previous years that were part of a whole simulation playbook of what we needed to do, and then we had a pandemic hit, and we didn't do all the things that we had been educated to do. Are we getting it right in monkeypox, and what is this supply sitting somewhere that we're not? I mean, there's a lot of controversy over whether our governance and inspectors are allowing the flow of vaccines, and I guess the big question, my friend, is are we botching it again?
I don't think we're botching it again. I mean, I think, first of all, very different. People love bringing up, this looks like COVID all over again. It's not like
well,
COVID.
I'm not sure.
No,
and
let me explain why, right? I mean, first of all, with monkeypox, this is a virus we know. Remember, in the first 2 months of COVID, or 3 months, 4 months.
We know it, but it's expanding like crazy.
I know, but in the early days of COVID, no one could get a test. We have widespread availability of testing. It's a really critical part of getting this disease under control. In terms of these vaccines, we had some sitting in a national stockpile. The moment we got to about 50 cases in the US, we immediately said, all right, let's get as much vaccines here. We had about 800,000 sitting finished in Denmark. Inspectors went over, checked out the plants. They're running some basic assays. My expectation is that's going to be done in the next few days, within the next week or so. Those doses will become widely available. The point is, we are moving very quickly. I mean, there's no comparison to what happened with COVID.
And are you responsible for that also?
I am not.
Is there another coordinator for that?
So first of all, CDC is the lead agency, obviously. We have an office within the National Security Council that deals with this and kind of helps coordinate it from the White House. So Raj Punjabi runs that office. Obviously, as a senior public health person in the White House, I end up giving advice and getting involved, but this very much run out of the National Security Council.
Let me ask you, kind of finally, and I know this is kind of a soft question in a way, but I'm interested, someone in your role, obviously earnest, obviously trying to remedy a big public health crisis. I am a critic of our lack of investment in public health infrastructure. What do you need from those people listening right now? There are a ton of people listening online. A lot of people out here. Do you need them to lobby Congress to give you more money for the next virus or vaccine? Do you need people to go into community? I mean, what are the elements that are missing? I mean, I'm a harsher because I'm a storyteller. I'm always interested in who the heroes in a story are and who the villains. How does this community help you with the villains in your story?
Yeah, I don't know if there are very many villains. I mean, the way I look at it is, what do we need? So first of all, this pandemic is not over, and we need to stay on the front footing. I mean, part of the reason why things for many people feel like, oh, they're not so bad right now, is because we are being very aggressive in countering the virus with vaccines, with treatments. If we took our foot off the pedal, we're going to see this virus come back in a way that's much more dangerous. So we've got to stay on that front footing and continue fighting this thing. Second is
And that means globally too, right?
every variant that has hit the United States came out of it was first identified elsewhere. The idea that you have a domestic-only approach to a global pandemic makes no sense whatsoever. So until we have a truly, and the administration has been very aggressive on this with vaccines, with requests, but again, our friends in Congress haven't always been willing to fund the global stuff. I think that's a mistake. But there are a set of lessons here about the importance of having a public health infrastructure, having good data systems. Right. And the problem is, when you're not in a crisis, not investing in those things is not a big deal. You don't notice. And the moment a crisis hits, you realize, oh my God.
You have a heart attack.
Yeah, and by the way, we have models for this, right? We have the military. We invest in our military. Most days, thankfully, we don't need to use the full force of the military. But we are really thankful they are there, and we're willing to make those investments. We got to do the same thing with public health as a health security. Make the investments, knowing that hopefully we'll never need to use it. But if we do, we're ready.
Let me ask you one final question. When the coronavirus hit, the world seized up. We saw vaccine nationalism emerge, and countries weren't sharing with countries. We saw a massive race and hijacking of N95 masks, and N95 masks going for $2,000 on eBay, and we saw an insanity, concern about where our active pharmaceutical ingredients were made, mostly overseas in this case. Has there been any rationalization of that world? Or is the private sector now in a place where the provisions we need in terms of a crisis are there dependably? Or are we going back to a place where having that kind of redundancy built into the system is something we're not going to pay for?
Well, this is a very good question, and this is a question that I talked to a lot of our friends on the Hill about. So right now, we just made a decision to pull money out of having enough PPE in our strategic national stockpile to pay for vaccines for this fall. That is not a trade-off I wanted to make. But if the choice was have vaccines for elderly people in the fall or have enough PPE in our stockpile,
you're going to go vaccines.
We go vaccines, but let me tell you, the idea that we're not going to fill up our stockpiles with PPE for the next crisis seems like a really bad idea. So already we're starting.
If you want to do 800 words for the Hill on that, I can get it placed.
You know someone there?
Yeah, I do.
Okay.
Yeah,
so this is what happens when the acute sort of the phase of the pandemic where everybody was on board that we needed to make these investments. As we have made progress, there are people who feel like, we don't have to invest anymore. And then you get into this mode of already starting to take your eye off the ball on investments. I think that's a huge mistake. I think we need to make sure that we have the kind of stockpile redundancy capacity to get us through the rest of this pandemic and obviously be prepared for future ones.
Let's give a hand to Ashish Jha, White House Coronavirus Response Coordinator.
Thank you.
Thank you so much. What fun. I hope you'll come back.
I would love to.
Thank you so much.